When we enter someone's home, it's a mutual choice. The aide or the nurse is saying, this is a family that I connect with, that is a good fit for me and my schedule and my personality. And the family and the client is saying, this is somebody that I am willing to open up my home to and I trust to help me in the moments of highest crisis in my life. And that bond, that relationship, sometimes takes a few tries. It doesn't always happen the first time. But I've found, interestingly, that there's a match for everyone because these team members have chosen this profession. There's something in their heart that has led them to want to take care of others. You just got to find the right fit. And when it happens, sometimes unexpectedly, it is transformative for everybody involved.
That's David Baiada, the CEO of Bayada Home Health Care. And I'm Josh Nelson, Head of Healthcare at THL Partners. And this is Healthcare in Action. It's a podcast that explores the latest developments and innovations transforming the U.S. healthcare sector, from cutting-edge technology to thoughtful approaches to patient care. I'm here with my colleague, Jon Lange, who will lead us in a conversation about the home-based care landscape and how the latest innovations in technology and AI can drive better patient experience and help meet the increasing need for home-based care in the United States. Jon, take it away.
Thanks, Josh. Today, we'll look at one of the most important and fastest growing parts of the U.S. healthcare system, home-based care. It's a sector that supports seniors aging at home, medically complex children, and families seeking lower cost, higher quality care delivered where people most often want to be. Few organizations have shaped it more than Bayada Home Health Care, one of the nation's largest home-based care providers. In this episode, I spoke with David Baiada, who has served as CEO since 2017. Over its 50-year history, Bayada has grown from a single Philadelphia site into a large organization with 400 locations across 24 states and 5 countries. We discussed the company's founding ethos, its commitment to scalable quality, and the Baiada family's thoughtful and bold decision to convert the company into a nonprofit organization in order to ensure that Bayada's mission, vision, and values will endure for generations to come. And in another thoughtful move intended to sustain Bayada's mission over the long term, the organization recently announced that it will be welcoming its first non-family member CEO in March, when David will join the board of directors and serve as a senior advisor. David also shared really interesting perspectives on the future, from the rising demand for home-based services and the increasing workforce shortages ahead, to the role that virtual care, AI, and robotics can play in transforming how care is delivered in the home. We explored leadership, culture, and how the simple act of listening to customers and caregivers can make a real impact. So let's get into it. David, thank you so much for joining me today.
Great to be here. Thanks for having me.
For those who aren't familiar, would you just tell us a bit about Bayada Home Health Care?
Sure, I'd be happy to. Bayada is one of the nation's largest providers of home-based healthcare and the largest not-for-profit provider of home-based healthcare in the country. We deliver 7 different types of home-based services through a network of about 400 locations in 24 states and 5 countries. And really at the center of our now 50-year history is our mission, vision, and values that we call the Bayada Way, which really guides us around a common purpose to help people have a safe home life with comfort, independence, and dignity, and to do it for a very, very long time.
Bayada has a long and storied history. Can you just take us back to the founding, really? And what was the founding impulse, the founding mission, and how has that come through all the way to today?
Sure. So my father, Mark Baiada, was a 27-year-old aspiring social entrepreneur, maybe before the term existed, was interested in finding an industry where he could build a long-term, incrementally growing business over decades, a desire to do it coast to coast, and a desire to find something where he could also create some community impact and do something meaningful with his life. And so with about $16,000 and a really big, ambitious mission and set of objectives, he opened our first location in Philadelphia as a private pay personal care and support services provider to seniors in Philly with $16,000, 200 square feet, and a half-time nurse. And, since then has, through a lot of the same ethos of, focusing on people and thinking big, we've grown and evolved in so many different ways. And I look forward to talking about it more today.
Great. And you mentioned thinking big. And of course, Bayada has been a pioneer and a market leader for a long time. And so how has that played into your success? Because over time, there have been a lot of home healthcare providers. What is it about how you operated the business, your vision, your mission that allowed you to become a market leader?
Yeah. Well, I think a few things come to mind. One, like you said, goals are the foundation of long-term success, and setting a set of ambitious long-term goals was something that, and thinking big is something that my dad has always stood for and has never had a problem coming up with big, audacious, bold goals. I think we had a couple of guiding principles in terms of how we operated the business since the beginning that have also contributed to that sustainable growth over time. A few that come to mind. Number one is, we've always been focused on scale. How do you deliver a repeatable, consistent, high quality service experience, not just for the client and their family, but also for the employees and the caregivers? How do we do consistent, high quality work at scale? We've always said, if you're going to do something, don't do it unless you know you can do it in 1,000 places consistently with high quality. And so that's kept us focused on some of the tough decisions to do certain things, or maybe in certain cases, not do certain things. Second, I would point to common purpose and values. Well, at the beginning, they weren't exactly written down. We've always had a deep sense of purpose that and a mission and values system that I think embodied how we work together, how we treat each other, how we treat those out in the community. And the Bayada way, through the written word, has only institutionalized that common purpose in a much more sophisticated and successful way over time. And then lastly, I would just say it's really one of those core tenets of our value system, but putting our clients first, our customers first, being just an obsessively client-centric culture where our job is to deliver a high-quality service and do everything we possibly can to make that happen. And over time, if you deliver a great service and you build good teams of people that are equally committed to delivering that great service, the phone rings more often and you grow. The last thing I'll mention is we've been lucky. The need for home-based care and the benefits available to reimburse and pay for home-based care, the technology to enable different types of home-based care, all of these things have evolved to support an aging population and just a societal shift towards home as the center of the healthcare system. And we've just been able to adapt and evolve in parallel to the market overall.
It's so interesting to hear you describe it. And there are so many important pieces to that. But in particular, I find it sort of inspiring that not only are you putting clients first, not only are you starting with a market that has a huge need, but also this concept of thinking big. I saw an interview with Jeff Bezos not so long ago where he said something like, thinking small is a self-fulfilling prophecy. And I always love that concept. It can be difficult to set your sights on something big, but at the same time, unless you really have an audacious goal, it's hard to achieve it.
I would just add, John, that I think an important complement to thinking big is thinking long-term. Often, especially in services like ours, big, bold things take time. And our vision has always been long-term oriented. And we're working on 100-year time horizons, whereby if you want to last a long time, you have to think big because the world will pass you by if you don't.
Yeah, it's really interesting. I think that's a good segue. I know you have been a real thought leader around technology for home-based care. And so, that has small applications and big applications. And as you said, some of the things people are thinking about now seemed like science fiction, 3, 5, 10 years ago. So can you talk about some of the things you're most excited about in terms of technology that could advance home-based care?
Sure. One great example that gets some discussion within healthcare circles, but maybe underappreciated, is just the fact that there are a lot of people that receive care in a hospital setting today that could get the same level of care in the home. And technology is an enabler of that. It's not just technology like, monitoring systems and infusion pumps and other things that do matter, but the care coordination and communication technology so that a team can collaborate virtually to support someone getting care at home rather than need to be there physically all the time, like they might need in a hospital setting. There's just, if you were to ask the average, hospital executive, what percentage of the people that are sitting in observation beds or in an ED today could be receiving the same level of care with equal or greater quality and safety at home? The answer is usually somewhere between like 10 and 50%. And what's standing in the way is not the technology. It's adequate sort of organizational, structural, regulatory, and reimbursement frameworks. Technology will enable that to become replicable and scalable for sure. But there's a lot of really near-term opportunity to make impact there. When you start to move along the spectrum towards things that are more forward-looking, clearly virtual care of all types, monitoring, more sophisticated capabilities to deliver interventions virtually, to monitor risk, to coordinate care virtually, creates tons of opportunity. AI obviously introduces a whole new exploding category of forward-looking opportunity around technology-enabled care in the home. For one, maybe less exciting, it enables us to provide services much more efficiently so that we can do more with less. That helps bring down cost. It helps make services and service experiences more efficient and more seamless. And then, as I alluded to, I think robotics are in many ways the frontier. When you think of aging and a growing population of people that need care at home, it's not all medical. Much of what we do as a home-based care provider is as much social, emotional, environmental as it is medical. Isolation, depression, other forms of mental health that come with the aging process are a massive, massive component of the healthcare system in the aging population. And robotics can help certainly with companionship, with isolation, but also with basic activities of daily living for a very large cohort of seniors that are aging in place. And that stuff, what many of us might have thought would never see in our lifetime, is absolutely on the very near-term frontier over the next couple of years.
One thing you mentioned is the importance of attracting great leaders. Is there anything from your own experience, mentors you've had, lessons you've learned from them, which you think really shaped you as a leader?
Oh, definitely. One that stands out became probably my favorite, what we call key action written in the Bayada way. Once we codified in that document all of these values, and it's listen closely, show empathy, and respond to the needs of others. I find that in services, any type of service you purvey in your life, whether it's tutoring services or plumbing services, really anything, often one of the things that's most correlated with your satisfaction with that service is, did they listen? Did they listen, and were they authentically curious about what I needed and what I wanted and how I felt? And did they then actively address those things in an explicit and thoughtful way? And when I engage with clients that are unhappy with their service, often it's because they didn't feel adequately listened to. And so we teach listening and connection and empathy in a very, very intentional way, because it is often highly correlated with not just the service experience, but the quality outcomes as well.
It's really interesting, and there's so much there. But one thing I find particularly compelling and rare is the are you authentically interested? Often when you train someone to listen or you tell someone to listen, they might listen out of a sense of obligation or something. But to really authentically be interested and authentically engage and authentically be empathetic is so rare and so compelling when it happens as a customer.
Well said. I think importantly, though maybe somewhat nuanced for many people, there's a reason that compassion is one of our three values and not empathy. And that's because we define compassion as empathy in action. Empathy means you're tuning in and you're listening, but compassion means you're doing something about it. And you have to really want to act on that empathy in order to be compassionate. And it's the essence of what I think you were alluding to as well. Our job is to act on that empathy. And sometimes it's really hard. It's difficult. You have to overcome all kinds of obstacles to make a difference in someone's life beyond just listening and tuning in. Acting on it takes a whole different set of commitment and authenticity that often is what separates and helps us stand out.
Makes sense. Of course, you spend all your time leading a healthcare organization, but we are all consumers of the healthcare system ourselves. Are there any personal stories that stand out that inform how you operate your business?
One thing that I think inspires me to think about it that way is my own experience growing up. I had a grandmother who lived with us, and she had a disability and had a Bayada aide in the house on average 20, 25 hours a week. And, I was a kid and I wasn't paying much attention to in what way the aide was helping my grandmother every day. But what I remember about those caregivers was how they became a part of our family, how they were connected to and engaged like an aunt or a sibling, not like a professional paid caregiver. And that dynamic, I think teaches a few lessons. One, just the importance of relationships overall, but also the importance of that match, that connection, that sort of bond that happens with home-based care. When you're in a hospital, you don't get to choose the nurse that comes into your room. They're just assigned, right? When we enter someone's home, it's a mutual choice. The aide or the nurse is saying, this is a family that I connect with that is a good fit for me and my schedule and my personality. And the family and the client is saying, this is somebody that I am willing to open up my home to and I trust to help me in the moments of highest crisis in my life. And that bond, that relationship sometimes takes a few tries. It doesn't always happen the first time. But I've found, interestingly, that even the caregivers that some people would write off as unreliable or maybe difficult to employ, there's a match for everyone because these team members have chosen this profession. There's something in their heart that has led them to want to take care of others. You just got to find the right fit. And when it happens, sometimes unexpectedly, it is transformative for everybody involved. And that's why it's another way that we like to say our clients come first. This person needs help. You have to find a way to get it done, even if it takes a few tries, because that match will emerge. It exists. You just got to work at it.
It's fascinating to hear you say that. I've seen, a similar dynamic with my grandmother years ago and my parents more recently. But also I'm reminded I have a young son, and in finding a nanny, I was sort of surprised in how our process went because there are all these line items in the job description. And then at the end of the day, you sort of throw those out and you say, like, is this person going to love my son and care for my son and be empathetic and compassionate? And so it is interesting how you are bringing that to bear at scale and how maybe it is easier, more natural to think about that for a single engagement. But when you scale that up to tens of thousands of employees working every day, how do you optimize for that?
No doubt.
Finally, a number of people listening to, watching this podcast will be coming out of school, either college or business school or something like that, aspiring to be leaders at great healthcare organizations. Is there any advice you would give them either on where to focus or what qualities to develop so that they can be successful as leaders?
Yeah. A couple of things come to mind right out of the gate. Number one, I place high value in curiosity. I think in service businesses, healthcare and others, curiosity leads to learning. These services are complex. Every client interaction is different. Healthcare is not getting any simpler. Payer, reimbursement, regulation, labor. And most days, I'm making decisions on things that I've never done before, issues that I have not that much experience with. And if I don't enter that conversation with a sense of humility that this is something that I'm no expert on, and a curiosity to learn about it as much as I possibly can and as quickly as possibly I can in order to make good judgment, then it would never happen. It would never happen. And so curiosity at all levels, I think, leads to good things. The second, and maybe more important, is an expression of curiosity, which is to spend time where the care happens. I can't tell you how many people I've met, even in our sector of the healthcare system, who have rarely sat on the couch in the home of a client and rarely sat on the couch in the home of a caregiver until you sit and you talk and you listen and you engage and you connect with the work as it's happening, with the people who are experiencing and delivering it every day in the setting where it happens. It's all conceptual. It is all conceptual. And so we say inside of Bayada, you got to get on the couch and And I think, again, for new leaders, but for existing leaders as well, if you don't allocate the time to get on the couch, not only is it important so that you can tune into the work and use it as the basis for good decision making, and but it also like fills your cup, right? You don't get into this unless you have something inside of you that is drawn to the purpose of the delivery of a meaningful service in the healthcare setting. And when you watch it happening and you connect with the people that are doing and receiving it on a regular basis, it's like a massive energy driver that I think is really critical, because the work's really hard. It can get very stressful. Like, I'm bearing the burden of other people's life crises every single day. And without that connection and that energy, it's burnout city all day. And so getting on the couch, I think, is really, really important.
It's great advice and really resonates with me. At THL, we make a point of doing regular home visits for our home-based care providers as well. And it is so meaningful and does bring you back to, with every financial decision you make, with every business decision, how is that ultimately going to impact the patient? David, thank you so much for joining me. Really enjoyed the conversation. It's always a pleasure.
I enjoyed it as well. Thanks for having me.
Thank you for listening to Healthcare in Action, brought to you by THL. To help Healthcare in Action reach more listeners like you, either share this episode with a colleague, subscribe to the show, or rate or review us on Apple Podcasts. And for more background on THL's healthcare vertical, visit thl.com/verticals/healthcare.